So, na-address din natin yung problem again if ever the problem arises.
Okay. Now we have a texter again from 0939 488-0486. Haba, 86. Okay. Good morning, Doc. Sabi niya, meron ho ba pwedeng magamit na remedy dyan dito sa house, those who cannot afford to go to doctor? Kung meron daw remedy, let's say, for example, for those patient probably having this kind of wrinkles or pimple marks or stretch marks, is there any remedy? Parang house remedy siguro ang ibig niyan sabihin.
Now, with regards to house remedy regarding sa pimple marks, no, meron naman pwede tayong mag-apply ng mga to improve yung usually pag sinabing pimple marks, yun yung ang problema nila is yung hyperpigmented
hyperpigmentation,
part,
right?
Hindi na doon sa with regard kung ayan acne scars na malalalim, walang house remedy tayong pwedeng ano diyan. Pero doon sa mga hyperpigmented acne scars, pwede tayong magpunas ng mga bleaching cream to lighten the color ng scars.
Yes, yes. And siguro for especially prevention, no, for let's say pag nagkakaroon kasi ng pimples, the tendency especially for young for adolescent or young people, they kinakalikot, they
nada-damage yung skin.
Yes, nada-damage nila yung skin. At the same time, nagkakaroon ng scarring, and then yun, nagkakaroon na ng pimple mark.
Siyempre, the best pa rin yung healthy lifestyle. Dapat healthy living Dapat healthy food, regular exercise. Kasi minsan, di ba, may gising ka na talagang feeling mo, fresh na fresh ka. Kasi nanggagaling yan sa stress Kasi parang sa pagkakaalala ko dun sa texter natin, sinasabi niya yung mga wrinkles, mga fine lines. Di ba, minsan talaga napapansin mo yung may gising na okay ka.
Okay, we have another texter. How about melasma or probably the hyperpigmentation? Pwede bang i-laser to?
Now, with regards sa melasma, pwede rin nating i-laser to, no? But we'll be using yung specs na mas mababaw.
Okay.
Para magbalat lang siya. Then pag nagbalat siya, we have to make it sure, siguro din natin sa pasyente, bigyan natin ng advice, na wag muna magpapaaraw. Or else, baka magdoble yung kulay niya.
Well, for the information of the audience, of our televiewers, that melasma is a hyperpigmentation, probably caused by either overexposure to sunlight, hormonal influence, or patients who are taking hormonal pills.
But the most common is due to sun exposure.
Overexposure to sunlight, no? Okay. Now you said that it can be treated by
laser.
Our fractional laser.
Yeah, dun papasok yung skin resurfacing. So sinasabi nga ni Dr. Azores na medyo superficial lang.
Superficial.
So we're actually after the effect of yung peeling effect.
Now, you said that after is it for everybody after, let's say, having the laser treatment or fractional laser, and you got a hyperpigmentation, because we are Filipinos we are Asians pala and usually nagkakaroon tayo ng we are pigment formers.
Prone to pigmentation.
Very prone to pigment formers compared to Caucasians like the Americans or the Europeans. Even though i-laser mo sila, pigmentation will not be a problem for them. But we Filipinos, we are pigment formers, and if we undergone laser surgery, so that means there's a possibility na magkaroon ng tinatawag na hyperpigmentation, which is, Dr. Kendalisa said that it's very common to have hyperpigmentation after surgery. So what would be the regimen or the treatment for this if you have this hyperpigmentation?
Meron tayong mga ginagamit na mga creams, yung mga topical or pinapahid lang natin na medications, especially products containing hydroquinone.
Yes,
But in some other countries kasi medyo nakaban yung hydroquinone. But instead, they use kojic.
Other
acid. That's the alternative dun sa hydroquinone. Pero balikan ko lang yung sinasabi kong hyperpigmentation. That's actually post-inflammatory hyperpigmentations, yung tinatawag na PIH in a medical term. So iba naman yung sinasabi natin ng mga pigmentations na due to dun sa sun exposure. Tapos yung treatment kasi niyan, depending on the depth of the sa problem ng skin dun sa skin lesion.
Right. Like there's also a caller that if could laser treat some tattoo. Those tattoo...
ibang laser naman yun. Hindi yun yung tinatawag natin na fractional laser. Meron kasi tayo na tinatawag na ibang klase. Like, for instance, yung YAG laser for tattoo removal. Iba naman ang application.
So that can be... So that means that those tattoo thing can be removed or eliminated by
Yeah.
laser.
It's also a laser, pero not this particular machine that we're discussing right now.
Like this, again, there's another texter. Good morning, Doc. Can stretch marks recur after treatment of laser therapy? May maintenance po ba just in case for another pregnancy to avoid recurrence?
Okay,
Doctor,
now after one session ng treatment ng laser for stretch mark, no, definitely mag-i-improve ito, no. But
Yes,
syempre, pagka hindi natin tinanggal yung cause kung bakit nagkakaroon ng stretch mark,
Oo nga.
babalik pa rin at babalik yan.
Okay.
So pag bumalik, i-laser ulit natin to improve the quality ng skin ulit.
Dr. Dalisay, when you say stretch marks, because most women who had postpartum complication or postpartum results can have stretch marks, but some other women doesn't have stretch marks. So how do you explain for that?
Meron talaga tayong tinatawag na uniqueness or individuality ng bawat
Yes,
pasyente.
yes,
Yung
yes.
genes kasi yung nagdidikta.
Correct.
Meron talaga na kahit ang joke nga natin sa medical, yung mga grabe na grabe, di ba? Yung maraming panganak. Pero meron pa rin walang stretch marks. Meron namang isang beses lang nanganak, pero meron talaga. So depende sa lahi mo rin yun talaga.
You know,
Depende sa type ng skin mo.
we have a lot of texters and asking for your address. Maybe later on we will announce you the address of our doctors and even the telephone numbers where they could get in touch with them. Okay. All right. The Dr. Azores. All right. You said that stretch marks, Dr. Dalisay and Dr. Azores, can be hormonals, right? Can be
Genetics,
genetics. Okay. So that would be a hanging question for us. But before we, in our segment, we will have the live demonstration of our laser treatment when What's Up Doc returns. Yes, and we're back here in What's Up Doc, and as I have promised you that we will be doing a live demonstration of the laser procedure. Of course, together with our guest, Dr. Ken Dalisay here, and Dr. Derek Azores, and of course my staff, Ms. Hershey Ricalde. Okay, now right now we are having this what we call a fractional laser, Dr. Dalisay. Can you
Yes.
explain about the fractional lasers?
So, as I have discussed earlier,
Yes.
yung technology kasi nito, fractional, kasi yung buga ng laser fractionated to leave the surrounding area na normal for rapid recovery of the skin or healing process.
Right. Okay. Now, our patient here, itago natin siya sa pangalang Ella. At we will be doing a what we call a laser of the our stretch marks.
Stretch
The
marks.
most common problem of women, especially right now, alam mo, Dr. Ken Dalisay, magsa-summer women are dreaming to wear the expose their body during summertime. Of
the
course,
larger
beach
part
ka,
of their skin
right,
surface.
and probably suit ka ng two-piece. So maybe after the laser procedure of stretch marks, and which the most common problem of women, at siguro ma-eliminate natin or rather improve the stretch marks of a patient, especially for a patient who had like a previous pregnancy and patient who also lose some weight and then after losing some weight magre-wrinkle yung skins nila, at the same time magkakaroon ng stretch marks, and now you will see how we do it, and it's an outpatient procedure.
Yeah.
So, initially, what we did here, Dr. Dalisay?
Nag-apply tayo ng topical anesthesia, and then iniwan natin for about 20 minutes.
Okay.
And then, so sa ngayon, ready na yung pasyente. So, wala na siya dapat mapi-feel.
Okay.
No?
So, we place already a topical anesthesia here. So
anesthesia.
how many minutes yung topical anesthesia?
Depending on sa produkto na ginamit natin, meron kasing mga anesthesia na after 15 minutes, 20 minutes, 30 minutes, and the most
average is like around 45.
Yeah.
Right. Okay. So here is Dr. Azores, who will be doing the actual live demonstration of a laser treatment.
Okay, good morning everyone. What I'm doing here is I'm wiping off the excess topical anesthesia that was applied 20 minutes ago. And now we're going to do, after I've already preset this machine for the demo of stretch mark removal. Okay.
Okay, well, you will see some lights emitting on our. Okay.
So yun, medyo nagugulat na konti yung pasyente, pero actually yung discomfort, pero hindi, not actually the pain, pero yung gulat na may
Okay, parang kinakaliti lang siya. Okay. And of course, you have to protect the patient wearing those eye gears to protect the eyes of the patient.
The eye shield para just hindi maiwasan yung aksidente.
Yeah, this is how easy it is, no? And you will see some lights emitting on the skin of the patient, and eventually, halos parang nawawala kagad no? Okay, and we did produce some inflammation or hyperpigmentation.
Yeah, yung normal process kasi ng pagka nagkakaroon tayo ng wound, it's actually ang ginagawa intentional na ginagawa natin ng wound, no?
Okay.
So sa lahat ng may wound, yung inflammation kasi normal process yun, kasama talaga sa healing process.
Okay. There's a texter here. Ang sabi niya, applicable from Jude Hunsay o Pedro Hill Street, Santa Ana, Manila. Sabi niya, applicable po ba yung laser sa scar ng skin asthma, Dr. Dalisay?
Of course, any type, any kind of scar, applicable itong fractional laser na to, Pero kung yung skin asthma mismo, different story na yun, But the scar, pwede nating address yung problem na yun using this kind of technology.
Okay. Sabi niya, there's another texters. I'm allergic to siguro hydroquinone. No, what is the other whitening medium that you could apply to?
As I've said, dun kasi may isang particular na lugar dito sa mundo, isang bansa, na hindi na nila ginagamit yung hydroquinone, but instead, ni-replace nila ito with kojic acid.
Kojic. Or probably like Melawite, you have a lot of
a lot of mga alternatibo na medications, pero yun yung medyo popular in terms
Now,
of
you can
whitening.
also, again, you can text us your questions or comments at 0922 861-6761. I mean 891-6761, and please indicate your name and where your location so that we know kung hanggang saan kami nakakarating. Alam mo, Dr. Dalisay, our program ay nakakarating hanggang Zamboanga, Davao, Apari, and it's
all over the Philippines.
All over the Philippines.
Meron din tayo sa Hong Kong, Taiwan,
yes.
Japan. Japan, sorry.
Yes, while we're doing a laser procedure here, ayan, nakapokus ngayon sa camera ninyo, at you can, wow, it's nice, it's just like parang, it's a beam of lights that touches the skin, and probably there will be maybe a little irritation or something after, or redness. It's very common to this procedure, no?
Then after a few days, mapapansin ng pasyente yan na magkakaroon ng konting parang darkening kasi natutuyo na yung skin surface kasi naghihil nga siya. And then eventually magpipil siya, parang scab, naglalangib siya.
Nagpipil off to yung skin?
Nagpipil,
Okay, how many days you could observe the peeling of the skin?
After a week, 5 to 7 days the most, mga 2 weeks, depende dun sa type ng skin ng tao.
And this also can be applied to some of the scars in the face, like yung pimple mark ba? It's just like those deep pimple mark can be this fractional laser can be applied, right?
With this kind of technology, with this kind of procedure, masasabi ko kasi na pinaka-epektibo to lalo na nga dun sa acne scar sa face kasi unang-una kasi sa face napakaganda ng healing process, napaka-highly vascularized kasi ng area na to, meaning para sa mga viewers natin, maganda yung supply ng dugo, maganda yung oxygenation. So kahit ano yung ginagawa natin diyan, mas maganda yung respond ng sa treatment, yung healing process. Kaya once you trigger the layer of the skin where the collagen lies, mas magiging maganda yung result na nakikita natin compared to any part of the body.
Okay.
Uh-huh.
So this is like what you call an out